My name is Chris Morris. I'm from the Asian Development Bank. I'm head of the NGO and Civil Society Centre. And we have with me today Ms. Anju Gurung from Nepal.
Namaste.
I have been practicing my sign language. My
Great.
name is Chris.
Chris.
And I have a special sign name, which is Chris. Anju also has a name.
My name is Anju. That's my sign name, Anju.
Anju.
Anju Gurung.
So welcome to the Asian Development Bank and to the Philippines, to the Asian Youth Forum.
Thank you very much.
Firstly, I'd like to congratulate you on your presentation this morning at the People's Session. It certainly raised a lot of important questions, particularly amongst the marginalized communities that are so important in Asia and the Pacific. First, I'd like to, for our audience, share a little bit about your story, Anju.
Thank you very much for this opportunity. I'm very glad that I get this opportunity to speak this morning and again here with you. About me, I was born not deaf. I was hearing when I was born. So when I was 3 years old, I lost my hearing. And I started going to school at the age of 8. I was quite late going to school because my father and my mom, they don't know about deaf school, and they went to doctor first and they tried to fix my hearing, and they want me to be hearing, but then after when they figured out that I can't hear anymore, so then they look for a school, and then I went to school. So I think the crucial time I lost, because that was the period I should have learned language. I couldn't get language up to age of 8. So after finishing the school from the deaf school in Kathmandu, and I went to India, because there is no formal education after grade 12 in Nepal, so I have to go to India and learn about sign language, and more detailed study I have done in sign language. I have done my bachelor in sign linguistics from India. Now I'm kind of I also worked for Medistop for a data collection project for the reproductive health system of disabled people in Nepal. So it was more focused on disability group and the reproductive health, how the reproductive health system is accessible for deaf and other kind of person with disability or not. We hand over the report then after.
Could we explore a little bit about the number of other deaf people there are in Nepal in a similar situation?
About the census, with deaf federation in Nepal, they think that it should be 300,000 to 400,000 deaf people in Nepal, but the data is not that clear yet.
So the statistics about the number of deaf people is not particularly good. But I understand
Yes.
there are, of the 300,000 or 400,000 deaf people, there's something like 25,000 who have skills like you, can communicate using sign language.
True.
How important is that to you?
I think, for example, like a hearing child, when born and then start learning from father or mother or people in the family talking, so get language from there. And for deaf people, it should be all visual. So I can't hear, so I have to rely on my eyes to see the things and get the knowledge about the things. And without that, it's very difficult for me. So that sign language is very important.
So you said you first went to school when you were 8.
Yes.
That was a special school to learn sign language?
Yes.
And how many similar schools are there in Nepal?
We have 19 deaf schools in Nepal, all over Nepal. in 75 districts, we have in 19 districts.
So what sort of percent of deaf people actually go to these specialized schools?
So mostly, so if you look at Nepal, the map, so in Kathmandu we have a deaf school, and the people nearby Kathmandu area, if they have a deaf children, it's very easy for them to send to them, and they can go to school. It's same with some other areas as well.
I know from your presentation earlier, you mentioned the difference between being differentially able and being disabled. Can you explain a little bit of the difference for you personally?
So differently able is like kind of that's differentiating actually. So I'm I'm a disabled because I can't hear. That doesn't mean that I hear from my eyes from my other organ. I don't have a different specialty actually. I don't have a different ability. That's not my different ability. I do have my problems. I can't hear. That's the reality. That's
Right.
my identity. That's why we like to call ourselves person with disability. And the United Convention on Right of Person with Disability has also clearly mentioned that it should be called person with disability.
So you have a disability because you are deaf.
Yes, that's my identity. Yes, I accept that.
As such, do you feel marginalized in communities, in your family? What is the result of your disability?
Yeah. So in community, especially kind of like programs when they have, I was not invited or I was not part of that program. In family as well, if they have something planned program like some program they are going to do, and I was not involved in that in planning, and also sometimes going with the people. I don't know communication with them, and so I just feel very bored going in community in group.
So, as with your disability, that creates a situation where you're marginalized. Does society on a whole, in terms of programs from government, facilities, also affects you as a marginalized person?
Yeah, I think so. There are some barriers created by the community. So sometimes they think that I can't do anything, and they think that I'm dumb. I can't understand anything. I can't make a decision. And talking about government, I think they don't have that kind of mechanism to look disability and make a kind of planning for development disabled people in Nepal.
Well, clearly, with your Bachelor of Arts from India and your ability to speak and move such an audience this morning, you would have certainly convinced our audience that you shouldn't be considered a marginalized person, or with the disability, it doesn't affect your ability to contribute. How do you think youth, the rest of the participants we have at the conference this week can work with you to help support the several 100,000 other deaf people in Nepal?
I think the most important thing is inclusion. So I came here in Philippines, and I feel very good talking with the people there, and I feel kind of a friendly environment we are having with the participant, and many participants also wanted to work with me. Like sometimes I don't have interpreters when there is a break or tea break. Sometimes I have to communicate, and we just write with each other for communication. I think that's something coordination they can do with other deaf people as well.
Yes, certainly communication is something that I've learned in my life you can do even if you don't speak the same language or you don't hear each other.
Yeah, I think language is very important.
Those skills. So you mentioned inclusion. You've spent the last 4 or 5 days out working with the youth in the local communities. Can you share a little bit about your experience?
So I think it was very amazing experience for me for lifetime, and I was kind of included in that group, and I always feel that I was part of a group. I never felt that I was alone. So that was one of the biggest experience I had, and I was able to share my experience with them when going for the research as well, in a group discussion as well, and I was part of the group all the time. So we went to the Gawat Kalina and spent a night with the people in the community, and I was in a house where there was children as well, and I was trying to communicate with them in kind of natural sign language, and that was very good communication we established.
Okay, we'll come back to sign language and the importance of that then. And you mentioned education. Your Bachelor of Arts is specializing in sign language. I understand that there are 10 to 15,000 words commonly spoken in language, but in the Nepalese sign language, there are only 5,000 words. Can you say something about your work to help increase the breadth of sign language in Nepal, and also the number of people that have the skill?
So previously only deaf people are gathered and they make this sign language, but I think that only deaf people cannot develop the sign language in a whole. We need the expertise, expert persons, and also linguists to develop the language, and I think we are doing that these days. So because making new signs is not like someone make a sign and then that started all the people doing the same. I think we have a kind of methodology developing a sign language, and we need to consult with many deaf people, many deaf associations, deaf schools. The important thing is that we need to think about the education, because only deaf people can get education through sign language. If there is no sign language, deaf people cannot get the education, and 5,000 words certainly is not enough for them to give all the learnings they need to have.
Okay, so we need to have a more diverse language, a wider language, but also I'm getting the message that it's extremely important, the number of facilities, the number of schools, the number of instructors to deal with the several 100,000 deaf people in Nepal is an essential area that needs addressing. And looking at Anju, people like yourself, that's a tremendous asset the government is not using by including you into the society and using your capabilities to help the country.
Yeah, I think.
I'd just like to say a little bit more about education and the importance of it. And sign language is itself. We're here at the Asia Youth Forum of the Asian Development Bank in the Philippines. The theme of the forum is the SDGs and inclusion of youth into the SDGs. From your side, how do you think, or how can you express the contribution in your eyes that young people can contribute to the SDGs?
So regarding SDG, so I think so it's very important that people should get the learning about SDG and what their roles first, so that they can start thinking about how we can start doing work for SDG achievement. So I think it's very important, and I had got that knowledge about SDG, and I think that's a very important one for our development as well. So I think whatever I learn, if I could spread, give this information to deaf youth in Nepal, that would be my contribution.
Okay, so we're going to summarize some of our discussions if I can, but I'd like you to help out on this. SDGs, I understand there's no United Nations or general word for it in sign language.
No, so we do S, D, and G.
So we do S. We've practiced
D.
this, and I'm not very good at the D.
Yes.
And then
G.
G.
Yes.
Right? So if you could do that, and I'll show you my sign language to contribute to the message of youth throughout Asia Pacific.
So can you just repeat the question?
Yes.
Sorry.
So if you do S,
S, D,
G.
G.
Okay. If you could do it again, and then I will do my
S,
signs for it as well.
D, G.
Okay. So thank you very much for taking time with us today, and Anju. SDG number 4, education, seems to be your priority.
Yes.
I know you also feel that SDG number 8, in terms of decent work and contribution of deaf and marginalized people, is something you're passionate about, and particularly the inclusion of young people and marginalized people into families, communities, and to contribute to society is something that's close to your heart.
And I think SDG, after SDG 8, so SDG 10 is also very important. It's about inequalities, because person with disability in their life, they feel not equal, and they are having this kind of feeling, and they are not treated in that way. So I think that's also very important.
For inclusion, of course, equity in SDG number 10. Thank you for reminding me of that. So thank you for joining us this afternoon at the Asian Development Bank. I'd also like to thank Samu for his support and contribution to the conference and to accompanying Anju. I wish you a fruitful further 2 days at the Asia Pacific Youth Forum. And thank you very much for joining us this afternoon.
Thank you very much for this opportunity. So I was able to explain about my work, about my learnings, my experiences, sharing. So I'm very, very glad, and thank you very much. So I'm very happy.
Okay, thank you very much.